Hello, my name is June Elama. I'm here to give a presentation on Human Immunity, Unit 17. The topic I'll be discussing will be non-specific defense, mode of transmission, first and second line of defense with barrier to infection, specific immunity and explanation of the third line of defense, its role to different immune cells, its disorder to immune system as well as self-recognition and tolerance on transplanted organs, the concept of vaccination illustrating the stages of acquired immunity and how the immune system reacts, the benefits of vaccination and the notion of herd immunity. Section 1. Defenses against disease, mode of transmission. Infectious disease occurs as a result of disorder caused by organisms. They include bacteria, virus, fungi, and parasites. Bacteria is a member of a wide group of unicellular microorganisms that are responsible for causing illness in humans as well as animals. Examples of such illness are pneumonia, meningitis, tuberculosis, and urinary tract infection. Viruses are infectious agents that are smaller than a bacteria but replicate only inside the living cells of an organism and may cause disease. Examples are common colds, chickenpox, HIV, and AIDS. Fungi is a group of spore-producing organisms feeding on organic matter. They are responsible for skin disease such as athlete's foot and ringworm. Parasite is an organism that lives in or on a host organism, thereby getting its food from the host organism. Examples are scabies and malaria. Defenses against disease, first line of defense. The body has three lines of defense that protects the cell and vital organs from infection. They include physical barrier. Examples of physical barrier are the skin, nasal hair, eyelash, eyelids, mucous membrane, and urination. Then we have the chemical barrier, which includes the skin pH 4.4, gastric acid 1.3. Then thirdly, we have the biological barrier, which includes non-specific immune cells, inflammatory signals, complement protein. All these defenses are genetically programmed and happens autonomously. Example of physical barrier is the skin. The skin is the largest organ in the body, which acts as a physical barrier to infection, and it is the most important primary line of defense against infectious disease, which comprises of three major layers, which are the epidermis, dermis, the subcutaneous layer. The epidermis is the outermost layer of the skin that acts as a waterproof that shields the penetration of microbial organisms as well as chemical irritants and harmful toxins from entering the body. For example, if the skin is bruised, it heals itself by forming a scab which acts as a temporal covering while the skin underneath heals. However, inner defense such as the saltiness of the skin and the presence of normal flora does not create a conducive environment for bacteria to grow. The second layer of the skin is the dermis. Dermis is the middle layer of the skin, which contains many specialized structures such as blood vessels, nerve endings, and hair follicles. And lastly, the last layer of the skin, which is the deepest layer of the skin, is mostly made of fat, connective tissues, and larger blood vessels, nerves. It acts as a shock absorber, protecting the body. Another example of physical barrier is the mucous membrane. Mucous membrane includes the eyes, nose, mouth, throat, gastrointestinal tract, respiratory tract, urogenital tract, and vaginal tract. They are the major interface between the external environment and the initial environment of the body. Mucous membrane assists the body to remain in its healthy status by allowing nutrients through whilst defending against pathogen. For example, the nose is part of the mucous membrane, while the surface is covered with cells that produce mucus and fine hairs called vibratory cilia. Below it has internal hairs which acts as shield against microorganisms. The mucus in the nose stops the pathogen from penetrating into the lungs Another example is the stomach. Stomach acid is a chemical barrier made up of hydrochloric acid with pH of 1.3, which kills microorganisms. The stomach acid, pancreatic enzymes, bile, and intestinal secretion are found in the gastrointestinal tract, and each provides a chemical barrier against infection. The movement of chyme through the digestive system by peristaltic contraction also helps to remove pathogens which may cause harm. According to some pathologists, some 70% of our immune system is located in our gastrointestinal tract, which illustrates how important it is to keep a healthy gut. Urinary tract is another area prone to infection in females, although it has effective barriers to infection. The female urethra is short and can create a passage for external bacteria to travel into the bladder. However, the bacteria are flushed out from the bladder. When flushed out, is emptied. The second line of defense, we have the inflammatory response. Inflammation is one of the second line of defense. Inflammatory response occurs when the tissues are injured by bacteria, trauma, toxins, and heat. When injury occurs, the body creates an inflammatory response. The physical effect includes dilation of blood vessels, forming gaps in the cell wall, thereby allowing the passage of blood cells, increasing blood flow, thereby creating inflammation. In addition, the surrounding area may appear swollen and feel warm to touch, which is as a result of the extra blood and proteins that attract infection. According to the diagram, it can be seen that the skin has been damaged and chemical signals have been released from the cells to alert phagocytes to move into the area to absorb the bacteria into a vesicle called phagosome. This process is known as phagocytosis, which is a second line of innate defense. Phagocytosis is the process whereby unicellular organisms consume and eliminate pathogens such as microbes of bacteria. The phagosome fuses with lysosome, thereby creating phagolysosome. The phagolysosome is filled with digestive enzymes which eliminates the contents and ends the process of phagocytosis. Section 2 will look at specific immunity and we'll be looking at cytokines and antigens. Cytokines are proteins produced by different cells to intensify the immune response through identifying, mediating inflammation and immunity. There are more than 30 complement protein which activates the presence of a pathogen. For example, they interact to produce a flow of reaction, thereby attracting phagocytes to remove unwanted particles and produce proteins to attack invading organisms. Antigens are molecules found in pathogens and often assist the pathogen to enter the body. Antigens make the immune system in the body by communicating to the cell of an attack. Macrophages have antigens, but neutrophils do not. The neutrophils are white blood cells and are often the first to get to the surrounding area of the infection or injury. These cells are medium-sized in shape and attach themselves to the walls of the blood vessels and stop microorganisms from accessing the bloodstream. Monocytes become macrophages to carry out the phagocytosis process. It can be seen as illustrated on the diagram. Third line of defense is the lymphocyte. The lymphocytes produce antibodies as part of the adaptive immune response. Lymphocytes are white blood cells found in the lymphatic tissue around the body. There are two types of lymphocytes, namely T cells and B cells. B cells are white blood cells that make antibodies and are part of the immune system developed from stem cells in the bone marrow. Examples are plasma cells that secrete antibodies into the circulatory system to provide immunity. T cells are white blood cells that is part of the immune system. They protect the body from infection and help fight cancer. Immunoglobulin. Immunoglobulin is an antibody which is in a Y-shaped protein used by the immune system to identify and weaken foreign bodies like microorganisms. Plasma cells are responsible for producing immunoglobulin. There are 5 types which are classified. We have the IgG, IgM, IgA, IgD, and IgA. IgG is the most common immunoglobulin found in blood and body fluids and protects against bacterial and viral infection. It is the only immunoglobulin that can pass from mother to child via the umbilical cord and placenta. IgM is found mainly in blood and lymph, and it is the first antibody that fights when a new infection arises. IgA is found in the lining of the respiratory tract and the digestive system, as well as in saliva and breast milk. IgD is least found in the blood. IgE attaches itself to the mucous membrane and skin, where they can release histamine allergic reactions such as hay fever and hives. Section 2. Self-recognition and tolerance to own tissues. Self-recognition is the capacity of the immune system to acknowledge self-produced antibody as a non-threat while setting up a feedback to foreign substance. The antigen present outside the cell transmits to the body, whether it is foreign or self. All nucleated cells have unique molecules on their surface, which gives each type of specific identity. These are known as self-markers and are formally named histocompatibility complex molecules. The immune system has self-tolerance, which means it will not attack cells with these identity tags as it recognizes them as its own. Sensitivity to antigens. Hypersensitivity, a reaction whereby abnormal immune system is caused by constant exposure to a specific antigen. Hypersensitivity are classified into 4 types, namely type 1, type 2, type 3, and type 4. Type 1 is immediate reaction mediated by IgE antibodies, e.g. allergies. Type 2 is an antibody-mediated cytotoxic reaction mediated by IgG or IgM antibodies. Examples are reaction to drugs and blood transfusion. Type 3 are immune complex mediated, which can cause inflammatory response. Example is rheumatoid arthritis. And type 4 is cell-mediated delayed reaction mediated by cellular response, for example, type 1 diabetes. Section 2, we're looking at the autoimmune disease. Autoimmune disease are conditions whereby the immune system mistakenly attacks your own body. The body's natural defense system can't tell the difference between your own cells and foreign cells. There are 5 of the most common autoimmune diseases, namely lupus, rheumatoid arthritis, psoriasis, multiple sclerosis. The 2 I'll be describing is the rheumatoid and the type 1 diabetes. Rheumatoid arthritis is categorized as a type 3 hypersensitivity. It is a long-term autoimmune disorder that affects joints, and its common symptoms are swollen, warm, and painful joints. These symptoms may fluctuate and worsen. Type 1 diabetes is categorized under hypersensitivity type 4. It is a long-term autoimmune disorder. Type 1 diabetes occurs when the immune system attacks the insulin-producing cells in the body, and common symptoms are frequent urination, blood vision, thirst, and excessive weight loss. Organ transplant. An organ transplant is a medical procedure whereby a malfunctioning organ is corrected with a healthy organ given by a donor, while transplantation is the process of transplanting cells, tissues, or organs from one person to another to replace the damaged organ with a healthy organ. There are 3 types of organ rejection. There is the chronic, hyperacute, and the acute. Chronic can occur over many years where the body immune response gradually damages the new organ, and the symptoms is pain. Hyperacute occurs a few minutes after the transplant when the antigens are completely unattached, and most of the signs and symptoms are feeling unwell and flu symptoms, while the acute happens days to months after transplantation caused by attacking T cytotoxic lymphocytes, and the signs and symptoms are decrease in urine output, swelling, weight change, and fever. Section 3. Acquired immunity. Acquired immunity develops when a person's immune system responds to a particular disease, thereby creating antibodies either naturally or artificially. Artificial immunity is acquired when antigens are intentionally exposed to the body through vaccine, which triggers the immune system to respond and create antibodies, just like active immunity. Natural passive immunity happens during pregnancy when antibodies are passed from maternal blood into fetal bloodstream. Artificially induced passive immunity is acquired from an individual that receives antibodies produced by someone in the form of a transfusion or injection. This form of immunity lasts for a period of several weeks as the immune system itself is not stimulated. The immune response to vaccination. Vaccination is a treatment given to trigger immunity to a particular infectious disease or pathogen. Vaccines are made up of harmless sections of bacteria which have been treated in order to make them harmless. According to the NHS, it explained that vaccines teach your immune system how to create antibodies that protect you from microorganisms. It is much safer for the immune system to learn this through vaccination than by being infected with the disease and then being treated. And once the immune system knows how to fight a disease, it can protect you for many years. Immunological memory, section 3. Immunological memory is ability of the immune system to speedily and clearly accept an antigen that the body has earlier come across. The primary response is when a pathogen is encountered for the first time. It takes time for the B cells to identify and find the right antibody to tackle it. Second response is when the pathogen is encountered the second time. The memory cells identifies the pathogen and produce higher amount of the antibody, which tackles the infection before the symptoms arise. According to the diagram, the concentration of the antibodies specifically increases as time progresses, which means that after the initial exposure, the secondary exposure always produces more antibodies that can tackle the infection more quickly and more effectively. Measles infection. Measles is a respiratory tract viral infection that is contagious. It is spread through cough and sneeze. Symptoms include fever, a rash, and inflammation of the upper section of the respiratory tract. According to the annual reports, the Vaccination Project explains the annual number of documented cases of measles in the UK between 1940 and 1995. From the graph, there is rise in measles in the UK prior to the introduction of the measles vaccine in 1968. And based on the statistics, there was a decline in infection rate after the introduction of the vaccine. The second vaccine, MMR vaccine, was introduced in 1988. There was a reduction in infection and mortality rate. Figures from Public Health England showed 2 people died as a result of measles from 1999 to 2017. Herd immunity. Herd immunity occurs when a large population of a community become immune to an infectious disease. The concept of herd immunity comes from the belief that if a large population are protected with a vaccination or natural immunity, there is less likelihood for infection to spread. However, there are a number of problems that can occur during an outbreak. before the population reaches a level of immunity high enough to reach herd immunity. Vaccines program. Vaccination programs are put in place and aimed to eliminate illness and create the best chance in obtaining herd immunity. Vaccination programs cover diseases such as polio, tetanus, measles, and influenza. Examples of vaccine programs include influenza vaccine program, which is the flu vaccine, SARS COVID vaccination, which is the COVID-19 vaccination, MMR vaccination program, which involves measles, mumps, rubella, and rubella vaccination. Then factors affecting vaccination uptake. Over the recent years, there have been many health scare over vaccination, which creates a certain amount of doubt, misinformation, and serious side effects from the vaccine. This makes it difficult for people to find the facts about vaccine. For instance, according to the Center for Disease Control and Prevention 2019, studies show that flu vaccine reduced the risk of flu illness between 40% and 60% among the overall population, although quite a number of people don't take flu vaccine based on the fear of side effects. And factors affecting vaccination uptake are missing vaccination appointments, health scares over the safety of certain vaccination, recovering from illness that prevents vaccination, resistance vaccination, political and religious beliefs. Here are the image sources, and this is the end of my presentation. Thanks for listening.